Hi, I'm Trish. Got a feeling this video is not going to work, but we'll give it a go. You would not believe the setup I've got on this. Now I'm hoping it works better than my last video. That was sort of like zooming in and out all the time. If that happens again with this video, because I know I won't want to make it again, I promise from my next video I will recharge up my shitty old phone that at least took decent video. So this might be, let's call this one an experiment. Anyway, and sorry if I seem a little bit frazzled and everything. I just I was driving home from my gynecologist appointment and I had a car spider and I nearly died. Not from the spider, but because I jumped out into the car into traffic and then nearly asphyxiated on all the bug spray fumes that I was using to try to kill the spider, and then I don't know how I didn't give myself a heart attack. It was so traumatic. I do not deal with spiders, and he wasn't a big one. He was only about this big, but that's big enough when he's like right here. Anyway, as I said, I was just coming home from my gynecologist appointment. Had to go and see him because the endometrial ablation that I had back when I had it, May, I think. I don't know. Might be lying. I'll put down in the description exactly when it was, but I think it was May. That has failed, or it might have been in February. No, I think it was in May. That has failed. I went for about 3 months with no periods. I was just getting a little bit of cramping about once a month, but not even for a full day. I'd just get a bit of cramping and that would go away. I did have then, after 3 months, I had sort of like a period, but it wasn't really a period. It was just like brown discharge, and it was very light. And I use a panty liner every day, but that's all I needed because, and it wasn't even going onto the panty liner. It was just when I was wiping, so I wasn't worried about that. But then, since then, I have had periods. I think I've had 3 periods. All over this place, like a 23-day cycle, a 37-day cycle, and bleeding for 9 or 10 days at a time, and just bleeding really, really heavily. The last one I had, I got up one night because I'd bled through my tampon. Tampons I had 2 in, I double load when I'm bleeding heavy like that, and there was just it was like a crime scene, literally like a crime scene. There was blood on my sheet, there was blood on my doona cover. Luckily managed to not get any blood on the short space of carpet that I've got to walk across to get to my bathroom. There was blood all over the floor, blood all over the toilet seat, and then I just sat on the toilet, literally just waiting for the blood to stop running out of me. I was bleeding that heavy. It was just running out of me. So I called my gynecologist because he's oh my god, he's just fantastic. I've been seeing him for years. He's wonderful, and he doesn't mind me just calling him if I've got a problem. I don't always have to make an appointment. So I called him and he said, yeah, this sounds like the ablation has failed. And from the reading I've done on Dr. Google, apparently 25% of ablations do fail. They either fail within the first few months or they have like a late onset fail, 5, 10, 15 years down the track. So, and I've been getting also a lot of really big blood clots, a lot of really yucky, just disgusting brown mucousy discharge coming out of me. You don't want to see that shit coming out of your body. And I've been getting a lot of lower abdominal cramping, like not normal period pain cramping. This is like next level. It's really, really bad. I even had a situation before my last really big bleed, like the day or two before, where just down one side of my labia and down the back of that same leg, it was aching. I was in so much pain. It just felt so congested and just aching. And then that stopped when the bleeding started. So I think that was just like pressure from the from whatever's going on inside my uterus. Plus I've been getting a really bad achy lower back pain. Now I do have problems with my lower back. I've got a bulging disc in my lower back. But as long as I don't do too much bending or, you know, anything like that, it's normally pretty good. And I've not been doing too much bending, so it shouldn't be hurting, but it has been. It's just been really aching. And, you know, just like when I'm just laying in bed, I can't get comfortable because my lower back is just screaming at me. So I spoke to my gynecologist today. I have to take Primalute, which is a high-dose synthetic progesterone. He said I can either take it for 2 weeks out of every cycle, so from day 10 to day 24 or day 25, to help to lessen my bleeding, or that might even stop the bleeding. Or he said it's a safe enough medication to just stay on all month round, and then I hopefully shouldn't get any periods. But that's not a long-term solution, particularly with the weight gain. Since I've gone back on that, and I have been gaining weight since I had my lap band out, but just in the last, I think I've only been on it for a week, and I've gained like 4 kilos. It's just ridiculous, and I think it's just fluid retention. So I've just got to cop that and try to minimise that part of the weight gain, or maybe just accept that that's what's going to happen until I can get treatment for this. Plus I have another drug called cyclocapron. In case I do start bleeding, then I take the cyclocapron, which will stop the blood flow within a couple of days. Because I can't be bleeding like this. My iron levels are down low. I'm getting out of breath over nothing. I'm getting palpitations. I'm getting lots of ectopic beats. I just have no energy. So I've also got to fight my GP to please give me an iron infusion, because I've been taking a high-dose iron supplement which just has not agreed with me at all. I initially had diarrhea from it, and then I had constipation, and this is really TMI for me. I have limits with what I will talk about, and so I'll just say this really quickly. My poo is like dark green tar, and it's just so fucking gross and disgusting. I'm getting a sore bum from just cleaning that shit, literally. So I have stopped, and I was also my anxiety got a lot worse as well with taking that supplement, and I know that it was the iron doing it, because I stopped taking it a few days ago, and the nocturnal panic attacks have stopped, and I'm sleeping much better. And other than today when I had to take some Valium because I was almost killed by a spider, my anxiety levels have been a lot better since stopping that iron supplement. So I've got that to deal with. He's written me up a referral to have an ultrasound done on Monday. It's Friday today, so I'll have that done on Monday, just to make sure that there's nothing sinister going on, and I guess so they can go in and have a look at and try to see what's causing the bleeding. It's probably just a failed ablation, but what can happen is because when you have the ablation, it can cause like scarring and adhesions in the uterus, and it can they can go over the cervix, so that and if there's still endometrium left there, or a polyp or a fibroid or something that's bleeding, your uterus can fill with blood, but it can't get out of your uterus because the cervix is sealed up, so that then it's contracting to try to push the blood out. And maybe I don't know, I've got a theory on this, and I apologise if this also is to just TMI, but you know me, I just say shit. I had been having a lot of really bad cramping and pain and everything, and I hadn't had a period for 37 days, and then I had some really fucking good sex, like really good sex. So I think that, you know, like that banging against the cervix may have helped to loosen up whatever was preventing the blood from coming out. So I think that might have sort of like triggered it. Maybe, I don't know, that's just my own little theory. Dr. Google didn't tell me that. My gynecologist didn't tell me that. But, you know, I find it was a very big coincidence. I was having a lot of pain, really good hard sex, and then it all came out. So, what was the other thing? Oh yeah, so when I saw I've got to have an ultrasound to make sure that there's no build-up of blood there. I think that's called a hematotera, but don't quote me on that. And it's just like a collection of blood that gets stuck in your uterus. And they can do a procedure where they dilate the cervix and they take down adhesions and they drain the blood and all that. But yeah, that's not something that I can be having done regularly, because I'm too pussy to have that done in my gynecologist's office with a local anaesthetic. I can't do that. That's much too painful. That is beyond my pain threshold. So he has, and with the ultrasound, I imagine they will also be looking for, if endometrium has grown back, if there's scars and adhesions, and they'll also be looking for polyps and fibroids. But I think they can only see fibroids that are on the inside of the uterus. I'm not sure. We'll find out on Monday. And he has put me on a Category 2 waiting list, which is between 30 and 90 days, to have a hysterectomy. Now, I had, because I knew that would be a very big possibility, I originally, if I had to have a hysterectomy, was going to say, please leave my ovaries, because there's nothing wrong with my ovaries, and please leave my cervix. But he has told me that given my age, because I'm 50, and I am like staring down the barrel of menopause anyway, it would be more beneficial for me to have them take my ovaries as well, because it might just speed up my menopause by, you know, like a couple of years. And I tend to agree with his thinking there. And also, no ovaries, no risk of ovarian cancer, and that is always something that is in the back of my mind. I have actually had a friend who died of ovarian cancer a few years ago. And also I asked him, if they do a hysterectomy, will they leave my cervix? And he said, no, there's no need to keep the cervix. They just close off the top of the vaginal canal, and it makes no difference to how sex feels for me, how sex feels for him, and makes no difference to how my orgasms will feel. So I'm all for that as well. And I thought as well that it might shorten my my vaginal canal, but it doesn't. So as long as all that's fine, I'm fine with that. They can take the whole kit and caboodle as long as everything still works fine. And then I don't have to worry about ovarian cancer, uterine cancer, or cervical cancer, and that works for me. 3 less cancers that my little brain has to worry about, and I do worry about a lot of medical stuff because I've got a lot of medical stuff going on. He also said that because I have had 2 previous caesareans, that it would be very, very unlikely that I would be able to have a vaginal hysterectomy. And I'm fine with that, because I watched a vaginal hysterectomy surgery on YouTube, and I spent the entire video all but like screaming at the screen saying, what are you doing? What are you doing to that woman? Stop, don't, what are you doing? I couldn't believe what I was seeing. Just, if you do have to have a vaginal hysterectomy, don't look up the video. Don't, you won't go to the hospital. It's horrific. It looks so violent. I didn't know that could be done to a vagina. I was horrified. And I've watched a lot of videos on surgery. I love surgery videos. He said that most likely, because I did have, my tubes done and, the laparoscopy and everything a few months ago, and they have seen, like, inside my pelvic cavity, and my uterus is very mobile and all this sort of thing, and I didn't have any adhesions or anything like that. He feels quite confident that they will be able to do the hysterectomy via keyhole, so laparoscopic surgery. That works for me. 2 tiny little cuts and a very quick recovery. But if they do have to do an open hysterectomy, which will be like a caesarean type cut, if need be, I'll do that. I have recovered from worse. So, and I think there was one last thing. I did ask him how soon after the surgery I would be able to have sex, and he said a month. And I said, really? A full month? And he said, yes. He said, maybe 2 weeks. He said, as long as it's not penetration sex or like hard sex. And I said to him, okay, so no non-penetration sex, or I said, could I just go just shallow sex? And he said, if your partner has the control to do that, then yes. So I know myself, it will be 2 weeks for me. Oh, someone's at the door. Oh, hang on, just let me get the door. Yeah, I know that I'll be good to go after 2 weeks because I had sex 2 weeks after my first caesarean and it was fine. Had to go easy, had to go on top and control it all, but I know I can do that. It'll be fine. And in all honesty, when I had the laparoscopy and the tubal ligation and everything, because there wasn't really much in the way of restrictions on that, I think I had sex after less than a week, I think, and I was fine. I think it was less than a week. I can't remember. I might be lying, but it won't be that long for me. And I think that was it. I'll have my ultrasound on Monday, and my ultrasound guy, he's really, really cool. That's how many ultrasounds I've had. I've got an ultrasound guy. He will tell me if there's any polyps or fibroids or whatever. He'll let me know what's going on. And honestly, I can look at an ultrasound well enough to know what I'm looking at to a degree. So I'll give everyone an update on that, but they're also copying my GP, so I will get the results from her because my gynaecologist isn't back till the end of the month. So I'll be able to give a little update on what we're looking at, and hopefully I can get this done fairly soon. I think they did it pretty quick last time, once I went on the list, although I did get bumped once. So hopefully it all sort of ties in with my sleeve surgery as well, because there's got to be 6-week wait in between those two. And this happened last time when I had my lap band removed and I had to have that other gynae surgery. They clashed, but it all worked out in the end. So that's it for now. Any more updates and I will let you know.